tube and the eyepiece, right? The tube's gonna be 45 degrees. The imaging plate's gonna be 45 degrees. And we just have to make sure that these two things line up, right? And then the patient's just in the middle of it, right? And we just have to figure out, okay, how does the tube and plate relate to how the patient is? So if we wanted to start off with the patient, first of all, I guess we're doing the left side, right?
Yeah.
So when you do your room setup, it's really important to kind of figure out which hip you're doing and how the room is going to accommodate that, right? With all the extra rooms that we have here, there's only one side the tube's going to be on, right? Which is going to be this side. The tube can't go on this side. So whenever the tube's on this side and we're going to be shooting this way or this way, we have to have the affected hip then away from us, right? So in this case, it would be the left hip that we're doing. If just say we were doing the right hip on the requisition, that's where I put the pillow over on this side, and then when the patient lays down, I instruct the patient to lay down their head on the pillow so that they're facing that way, so that when I do the cross table, that works, right?
Yeah.
So we're just going to assume it's the left side of the patient. So what I would suggest is that, the patients, let's just pretend they're completely ambulatory, there's nothing wrong with them. Does this room have a set holder? No, it does not. Okay, that's fine. We're gonna improvise. There's this guy. Maybe this guy. So it works. Okay, actually, did you want to just step off the bed for a second? I'm just gonna set this up a little bit better. So you want the patient at the edge of the mattress. It's not like super necessary, but it's, it just allows you to place the imaging plate on the table rather than like here, right? So, okay, so Tasia, if you just want to come back, you can lay down, head on the pillow. I just need your left hip just right up against the edge of the mattress here. For the 45-degree angle to work too, you need to make sure that the femur is aligned with the edge of the mattress, right? Because the reason why we're throwing 45 degrees this way is because your femoral nexus is at 45 degrees. So when we come in at 45 degrees, we're hitting that neck perpendicularly. So if that patient is tilted this way, that neck is not 45 degrees anymore. It becomes like this or like this, right? So for us to use 45 degrees, we have to have the patient nice and straight. Another variation of this view is we actually tilt the patient 45 degrees and we keep everything else straight, right? Don't worry about that now, but you may see that in clinical. So then, as a check for a technologist, you just want to make sure that you kind of look at the foot and make sure that the femur is kind of going straight, which it is. And then we're going to place this. I don't think it really shows in the PowerPoints where you should have this, but really, you should be looking to get this edge of the imaging plate, so the top end of it, kind of at the LCM of the patient, in between the LCM and the crest itself, right? So I like to start at the LCM, which is about here, okay? So then, do you mind just holding up for a second? And then I would suggest maybe using this 45-degree sponge, right? Just to kind of figure out the 45, because this tube will lock at 45, right? So we just want to make sure that this is at 45. So we can place this part of the sponge against the patient and then use this slope here just to kind of figure out what the 45 degree is, right? So we're just going to slide that in here. Okay, this is 45. And then what I'm hoping to do is, actually, I'm just going to move your shoulders over this way a little bit. Yeah, good. Is I'm just going to maybe, I think just for argument's sake, do you mind just holding it right now? Yeah. If you feel like you need to tape it, you can go ahead and tape it, but I'm just going to get Tasia just to hold it for now. Okay, so next, what I would probably try and find out is trying to figure out your center point on the patient, right? So the center point is on the femoral neck, or it's on the groin line. And how we figure that out is that we can use the bisector line. I think that would be something that would be reasonable to do when we're first learning. So we're just going to find the bisector line. So in order to find the bisector line, we need to find the ASIS, we need to find the greater trochanter, which is the pubic symphysis, and then we can start making some lines through there, right? So in order to find that, I found for the first 3 sets, it was hard for some students to kind of palpate the right areas. So we're going to start at the LCM. Okay, so LCM, lower costal margin, that's the bottom of your rib cage. Okay, so you're going to find that spot right at the bottom. And then when you go past it, you have that soft spot there, right? There's nothing there. We're going to keep going down until we feel that first bony structure, and then that's the top of your crest, okay? Once we find the top of the crest, we know the ASIS is anterior and inferior to that. So you're just going to maybe use your thumb and just kind of guesstimate where it is and be like, okay, I have it right here. So this is your ASIS. So I'm just going to put a piece of tape on it just so everyone knows where it is. And then to find your GT, use your palm. Don't kind of come in with like 1 or 2 fingers and try and find it. Use your whole palm. Place your palm where you think it is, and then slowly internally and externally rotate. And then you're gonna feel it somewhere along your palm. That helps you kind of pinpoint it rather than trying to just do it with one finger or two fingers. So put the whole palm there, you can feel it move. Okay, it's right there. And then I'm not gonna put this on your PS, but it's, sure, thank you. Yeah, right there, and then I'm gonna contribute midline. So it's about right here, all right? So we're gonna connect those two lines, bisecting in the middle, and then for me it's about 3 fingers and a pinky finger, so it should be about right here. This is where the groin line is, right there. Okay, so that's where the centering point is gonna come in when I shoot 45 degrees this way, roughly, okay, because it's just to be centered over the neck. So now we've done this here, we've done this on the patient, now I can go over and just work the tube now, because everything on this side is done, right? So now we're going to come back over here.
I missed the part. How did you know where to place the IP? Like you get the 45 degrees, but how did you know how high?
Cool. Okay. So the top of your imaging plate will end up somewhere either at your LCM or somewhere in between your LCM to your crest. So that soft spot there. So I like to place this at the top of the LCM first, because if we imagine the beam coming in 45 degrees, it's going to go to that femoral neck, and we still want it to hit mid-IP, right? Okay. So that's the reason why that we want to kind of start off at that height there, because I'm picturing it going through here and hitting the plate mid plate there. So now that I'm done the plate, I've done the patient. I know where the centering point is. Now I just have to make sure the tube actually goes through there now, right? Yeah. So how I'm going to achieve that is we're going to determine our centering point anterior posterior, which is this way and this way. And we have to determine your centering point now superior, inferior, proximal, distal, however you want to describe it, right? So what I would do first is I would probably open up your cones up and down so we can see that vertical crosshair there, right? So now what I'm going to do is I'm just going to make sure that vertical crosshair is going through that piece of tape, like so, right? So we can see it because we've opened up your cones top to bottom, right? If it's really close, we can't see where it's going. So open it up until you can actually see it on your plate, and then you can go right through that piece of tape there. All right, so that takes care of your proximal distal center point. And then now your anterior posterior center point, you're going to try and find the GT of the unaffected side, okay? And then you're going to go ahead and put a piece of tape there, whatever you want to do. But once you figure that out, it seems a little higher. So yeah, right here. So once you have this here, this will determine your anterior posterior. So let me see if this has a laser light here. Okay, so really I want this laser light at the level of the GT, and that's going to determine my anterior posterior, right? So I'm just going to, so the reason why I'm picking the GT as my centering point, A to P, is as long as the patient's not rotated, and as long as there's nothing super horrible going on the other side, this GT level is going to correspond with the other GT level, right? Everything's nice and symmetrical. So then I've set my centering point, proximal distal, I've set my center point A to P. So now what I'm, on paper, then what it means is that I'm going through the femoral neck right in the middle of it, right? Because I set this to be right in the middle of the femoral neck by finding the bisector line, and I'm at the correct level this way. I'm not too far posterior, I'm not too far anterior, I'm going right through that neck because I'm at the level of the GT. Does that make sense?
Is it okay that it doesn't look aligned to the plate though?
Yeah, so that's an eyeball right now. So then at the end, after I lift the leg up and everything, then what I would do is I would just shift that imaging plate ever so slightly up towards the head of it, and then just make it mid-IP again. So at this point, I'm already on this side. It's kind of like a Bucky dance thing. I'm not gonna really worry about that until everything's set. Okay. So this is where I'm like, okay, at this point, I'm ready to lift the leg up, right? If you can imagine if we had the leg up this whole time, super uncomfortable, right? So this is what the PowerPoints and the video I posted was kind of alluding to, is that everything can be done with this leg down, right? I don't need to lift this up quite yet. All right, so now that I'm ready, right, you could measure your SID, if you wanted to come in a little bit more, you want to remeasure that, sure, go ahead. In some of the rooms, if you can't hit 122, you're usually going to be a little bit longer. You're usually going to be maybe at like 130, 140. There it is. 130, 140, whatever it is, right? So what would you do your technique if our source is farther than 122?
Increase?
We would just increase it, right? Yeah, for sure. So consolidation, you're like, can't hit 122, I'm at 140. I'm going to increase my technique, right? If you find that the column or the tube is hitting the table, right, you can't get in close enough, then that's something you can do.
So I know that if you can't get to 122, you go to 100. Is there like a thing where you go to 180? If you can't get, or is it just you increase it as?
We're just gonna increase it and get us closer to 122. So if that falls at 135, we're gonna use 135. We're not just gonna go from 122 to 180 yet. Okay, so now we're ready to lift the leg up. So what I'm hoping to see is that we're hoping to see the vertical line going through the groin line, right? So making sure that we're going through the neck. And then from there, even if it's not going through the right spot, that's where we can fine tune it now, right? Like we don't have to really make too many big adjustments, right? Instead of having the leg up all the way. So we're just gonna bring your right leg up. Okay, we're gonna flex it, bend at the knee, place a nice big sponge underneath it. Maybe rotate this a bit so I can kind of see where the centering point is going through. Let's do that here. Sponge isn't the best. I'll see what this looks like here. I can see the centering point. Okay, that's all I need to see here. Okay, so we can see the vertical line there. Okay, so that's going through the piece of tape, but I would say that's a little distal, right? Because we should be kind of keep closer up towards the groin line here. So now instead of like, okay, like having to figure out a lot of things now, all I have to do is flip my table just to the left or towards the head a little bit, and then I'm done, just like that. So maybe my my line marking wasn't very good at the top there, right? But at least now that's all it takes. I'm not like moving it a huge amount. Anterior to posterior, this looks really good. So I'm pretty confident that we're at the level of the GT. So your soft tissue inclusion isn't necessary for this view. You don't need anterior, you don't need posterior soft tissue, you need the bone structure.
Oh, you don't.
You don't. So like I'm just gonna move this down just like this. So like if you've done something like this, where you have light spill on the table, you have a lot of light on the top, that's actually not very necessary, right? So you should be able to cone it down to something like that, where you have a sliver of light spill along the anterior surface because your femur sits more anterior and your thigh bone does posterior, and you can cut off a lot of that posterior soft tissue. Okay? So I'm really happy up and down, centering point. I'm happy centering point, proximal distal. I would just open it up side to side a little bit, right? Take advantage of that full 30 centimeters that you have with the imaging plate landscape. And just to make sure that you have four-sided collimation, maybe what you should do before lifting this up is just raising the level of your tube or opening up your cones just to see if you're getting four-sided collimation, right? So you can see here I'm off the plate on the left side. That's because I'm not centered to the IP, right? So that's where I would just move the IP up like this, just like that. Yeah, just get you put that there. Just so that now I have one side, two side, three side, and I'm gonna have that fourth side down below. And then I'm just gonna drop it back down to the level of the GT. Marker placement, place it just right here in the top corner, or you can take advantage of the soft tissue at the bottom and place it at the bottom there. Okay, so whatever you want. So once again, I'm just gonna bring this leg up. Thank you. Not giving you much to, yeah, thanks, perfect. I just need to see that cross here. There we go, perfect. Okay, and then now we can start thinking about internally rotating the foot, right, or the leg, 15 degrees if the patient is able to.
Yeah.
And then we can start thinking about also now throwing a filter on. So we're going to use the decubitus filter. We're going to start thinking about thick part of the filter to the thin part of the anatomy. So what do we think is the thick part of the anatomy, just looking at this? Is it up towards the hips or down towards the knees? What's thicker? Yeah, exactly. So I want the filtration to start at the vertical crosshair, but I want to think about, okay, what actually needs to filter. So to the left of the vertical line, we're going through both hips, right? So I don't want to have any filter there. But to the right of the vertical crosshair, I'm just going through that one leg. So the technique that we set for this view, when you measure your patient, you're going to measure through both hips. So therefore the technique reflects getting through that, which is about, let's say, 80 kV at 80 MAS. So that is obviously too much for just that one leg. So I want the filter to start at the crosshair to the right of it. And then I want the thin part of the filter closer to the hip because that's going to be thicker, the thicker part of the leg in comparison as you get down towards the knee where the leg gets smaller and smaller, right? So I want the thin part towards the hips and the thick part of the filter towards the knee. And then we're just going to place it just like so. And then we're going to be done with that. You can also use some lead here for scatter purposes. You can grab this guy here. This is our lead masking. Place it right on top of the thigh there. And that'll just help kind of collect some of that scatter, attenuate some of that scatter that's coming off this really large body part. So if we were just to recap everything in terms of like that 20-step checklist, you know, as long as you can take away just a few of those, I think that would be good. Setting up the imaging plate at the top of it near the LCM or somewhere in between the LCM and the crest first, and then readjusting that later after you get your centering point, right, to make sure it's mid-IP. Using that 45-degree sponge to create that 45-degree angle. Finding where you want to center on the patient, right? So finding that bisector line, finding the femoral neck, maybe placing just a piece of tape there just to let you know. And then when you come around to the tube, then our goal is just trying to get to that piece of tape now, right? So I need to set my proximal distal, right? Making sure I'm going through that piece of tape, going through the groin line, going through the femoral neck, and then anterior posterior, dropping or raising the tube so that I'm at the level of the GT. All with the leg down. And then you lift the leg up, make any small adjustments, whether you need to move the tube a little bit to go through the groin line, making small adjustments to the IP to making sure that it's going through mid-IP. And then at that point, you can internally rotate, maybe place the filter on, place the leg masking, internally rotating the foot, or the leg, sorry. And then hopefully you preset your technique, and then when you're ready to go, then you can just go back and hit the button, and then they can relax their leg. And the SID as well, right? You can hit 122, you're okay. Most of the times you're going to be farther away than 122, then you can just increase your technique.